Much discussion today about the report from the Health Ombud, Professor Malegapuru Makgoba. He submitted a report to Dr. Zweli Mkhize, Minister of Health. This in regard to the circumstances surrounding the care and death of Mr. Shonisani Lethole at Tembisa Hospital. The findings are absolutely alarming. Mr. Lethole was not given food. He did not receive his COVID-19 test results. He was nursed in a high-risk area. And this sentence certainly stands out, that the general care provided to Mr. Lethole, says Malegapuru Makgoba, was, quote, inhumane and negligent in that the healthcare providers at the Tembisa Hospital failed to give diligent attention, care and monitoring to a very ill patient. So we know what happened to this individual, and that is absolutely crucial and of huge importance to his loved ones who still mourn his loss. But the other key thing that does sometimes come out of investigations of this nature is indications of deeper problems in the system. And to talk about whether those deeper problems are systemic and Gauteng-wide and possibly countrywide, we're joined by the DA spokesperson, Shadow MEC for Health, Jack Bloom. Mr. Bloom, welcome, and thanks very much for your time.
Good afternoon. Good to be with you.
You would have seen the report. It's sobering in the main. It's harrowing in parts. Does this point to problems that we might find, even if it doesn't have these specific consequences, these specifically fatal consequences? Might we find similar things in other public health facilities in Gauteng?
I'm afraid very much so. You know, this particular incident was only investigated because a dying man tweeted his condition to the Minister of Health, who ordered an investigation by the Health Ombudsman. But frankly, I think this is happening in hospitals all over Gauteng, probably in the country. There are worse public hospitals that we know of. And it's just very sad. It just shows you how deeply rooted, systemic the problem is. But I think one of the major findings he made was that the Tembisa Hospital should never have been designated a COVID-19 treatment center in the first place. We all knew that it was grossly overcrowded, understaffed, under-resourced. And, you know, who in their right mind would designate a hospital like that to be at the front line of a major pandemic? So I think there's blame at various levels. You can start at the very top. We have, at the time that MEC for Health is now being dismissed, that's where the accountability ultimately is, and the former head of department who also resigned after he was suspended. You know, who took these decisions and who actually tolerated what was going on at that hospital when, quite frankly, it's been one of the problematic hospitals for years now.
So, Mr. Bloom, I want to go back on a sentence I've just read, but onto a very specific part. And Professor Makgoba says, the healthcare providers failed to give diligent attention, care and monitoring to a very ill patient. How do we get to the bottom of who those healthcare providers are? Because arguably a nurse who's been working for 48 hours with poor PPE and without the right equipment is, on the face of it, partly responsible, but can't certainly be held to account for performing badly in circumstances that don't allow them to perform well. If we're to get anything out of this, how do we break down who bears responsibility for what in a way that actually produces accountability, but more importantly, change going forward?
No, I think you're absolutely right. I mean, we have to look at this holistically. You know, that hospital is notoriously understaffed, notoriously overcrowded, and notoriously doesn't have enough equipment. And now, in the face of the pandemic, you know, can all the blame be put on the staff? But I think what does come out of the report, and I also followed the briefing that the Health Ombudsman gave, is that he said, you know, it was just, you know, negligence by our health staff that he thought could have been prevented even in the circumstance. He says there weren't proper systems in place, record keeping wasn't taken, so there's a management issue. there's very much a management issue, but we can't let the Gauteng Health Department off the hook for not ensuring that there was proper staffing and equipment in the first place. So I think it's multifaceted, and
yes.
I hope that the recommendations are implemented, not just for this hospital. I'm absolutely sure that the health ombudsman could have investigated various other cases at multiple hospitals in Gauteng,
right,
and would have come up with very similar analysis.
I'll tell you what concerns me, Mr. Bloom, and this is sort of my last take on this issue. Don't we often with inquiries get into a thing, well, there's blame at every level and there's a whole kind of general thing about who didn't do what. So if we just zone in, for example, on the fact that he didn't get food, either there's no food in the hospital to give the man, or there was food but people couldn't be bothered, or the systems that require some sort of checking as to whether someone's being fed don't work. Do you understand my desire to break this down? Because if it's a staff morale thing, it's one kind of problem. If it's the failure to procure, it's another kind of problem. And if all the money's been misused, that's a problem of a third nature. How do we get precise in this so we can get precise in our remedies?
No, I think you're absolutely correct, and I hope that this is realised when they implement the recommendations of the report.
Right.
It's multifaceted. It's honestly, I'm sure there's some very good people who try to do their very best in absolutely appalling circumstances, but this should be a case study for what can go wrong. But what about other hospitals? I really think there needs to be systemic change in the whole Gauteng Health Department, which we've been promised for years now that it will be, quote, turned around. I think it's time that we got a new head of department. There's too many acting positions at the moment. There is a new health MEC. I wish her the very best. I mean, she's honestly been placed into a very difficult situation. But that department, I think, genuinely needs to be properly restructured. And all the hospitals and clinics that fall under that department, I think we need to scrutinize very closely and make sure that there's accountability and that we're working, they have the resources to do what they need to do.
Thanks very much, Jack Bloom. Anyone work at Tembisa Hospital? Anyone work there in the past? Anyone else work in Gauteng hospitals or other points of healthcare provision who can shed some light as to what it's like working there? I mean, for example, and I'm hammering on this food thing, are there food shortages in our public health service provision points? And if so, why? Does anyone understand why that happened? Or was this the result of people simply not doing their work? I'd love to know a little bit more about it, understand it better, because then going forward, hopefully we can ask better questions.
News.
Experts.
Analysis.
Where things stand.
What you need to know. Drive home with John Perlman
On 702.